Avery Crow is a 27-year-old female. She is married but has no children. Avery has had no previous health problems for the entirety of her life. The only medical issue she deals with frequently is seasonal allergies, but she can typically take a 10 milligram tab of Zyrtec to relieve her symptoms. Avery is not a smoker, but was frequently exposed to a secondhand smoke for the first 18 years of her life, as her parents are both heavy smokers. Working as a cosmetologist, Avery is often exposed to chemicals when mixing hair dyes and dealing with bleach. Both her paternal grandmother and her father are currently dealing with COPD. Over the past 3 months, Avery noticed that her coughing and wheezing has gotten much worse, which is odd since these symptoms began occurring around March when it is still cold and there's not much pollen. She often becomes short of breath and begins wheezing even when exerting normal activities like walking up the stairs. She also realized that while she goes on her nightly jog or attends an hour-long Zumba class, her fingernails and lips turn a bluish-gray color. On June 7, 2015, Avery visits her general physician, Dr. Carolina Schatz, for a routine checkup. As a general physician, Dr. Schatz responds to medical and health problems presented by patients, including history taking, diagnosis, investigation, treatment, and referral as needed. Dr. Schatz helps to complete Avery's physical assessment, including temperature, blood pressure, weight, height, heart rate, and also checks her ears, nose, and throat. Avery brings up her concerns about her recent symptoms, including shortness of breath and blue-colored nails, as her symptoms have been worsening over the past 3 months. Avery's general physician refers her to a pulmonologist to seek further help. On July 19th of 2015, Avery sees a pulmonologist, Dr. Michael Dillon. After explaining her symptoms to the pulmonologist and he reviews her charts, Dr. Dillon decides to run a chest x-ray, lung function test with a spirometer, and a blood oxygenation saturation test. The X-ray, which is an image taken and results shown due to the different densities inside the body, comes back as normal. The blood oxygen saturation test, which is the clip that is put on the finger to read the color of the finger as light passes through it, revealed that Avery has a lower oxygen saturation level than what is considered normal by approximately 5%. The lung function test, also known as spirometry, where the patient blows into a monitor for a reading, shows that Avery has a lower total lung capacity, forced expiratory volume, and forced vital capacity than normal. Based on these results, Dr. Dillon was able to diagnose Avery with a disease called emphysema. Emphysema is the gradual damage of the air sacs, also known as alveoli, in the lungs. The inner walls of these sacs weaken and rupture, causing one larger sac opposed to many small sacs. Emphysema is one of the most numerous diseases known as chronic obstructive pulmonary disease, commonly called COPD, which both Avery's grandmother and father have. In a person who has emphysema, air becomes trapped when they inhale. The damaged alveoli are what causes air to become trapped, and therefore no fresh oxygenated air can enter like it should. Damage done to the alveoli cannot be reversed. Emphysema is often caused by frequent exposure to air pollutants, tobacco smoke, secondhand smoke, and fumes. Symptoms of emphysema include shortness of breath, lips and fingernails turning to a bluish-gray color with exertion, and also mental fogginess. Approximately 3.1 million Americans have been diagnosed with emphysema. Emphysema was first discovered as a separate disease by Théophile Bonnet in the 17th century. In 1898, the concept of sacs in the lungs as cells became the idea that these sacs were alveoli, which advanced the definition of emphysema to the dilation of alveoli and the atrophy of alveolar walls. There are 4 different stages of emphysema according to the Gold staging method. There is no official cure for emphysema, but there are some ways to prevent it from furthering and compromising health even more. One prescription Dr. Katelyn prescribed for Avery's emphysema is a bronchodilator, in this case, albuterol sulfate inhaler. This inhaler improves airflow by causing bronchial muscles to relax. The albuterol sulfate inhaler is a fast-acting medication, so it is useful when Avery has coughing fits or shortness of breath, especially when performing normal activities or working out. Another medication Dr. Katelyn gives Avery is a corticosteroid called fluticasone. This medication is a nasal spray which reduces inflammation in the airways, therefore relieves shortness of breath and excessive coughing. Lastly, Dr. Katelyn recommends that Avery attend respiratory therapy once a week to monitor her lung function and also to administer oxygen to make sure her blood oxygen saturation stays somewhat around normal. Also, at respiratory therapy, the respiratory therapist will discuss ways to help Avery maintain her lung function and prevent it from getting any worse, such as avoiding fumes and chemicals and second smoke as much as possible. 5 months later, on December 6th of 2015, Avery wakes up around 2:25 a.m. with a feeling of great pressure in her chest, and she is unable to catch her breath. Avery is so fatigued that all she wants to do is go back to sleep, but her husband makes her go to the ER to figure out what is going on. At the Gray Sloan Memorial Hospital emergency room, Avery meets with ER doctor April Kepner. Kepner assesses Avery as quickly and as efficiently as possible. As an ER doctor, Kepner stabilizes Avery to the best of her ability and decides a course of action. An X-ray and CT is run, and both show that Avery has a giant bullae in her lower left lung. This means that the alveolar walls in multiple alveoli ruptured and caused one giant sac to form. This giant sac prevents efficient airflow from happening, which is why Avery is unable to catch her breath and feels a lot of pressure build up in her chest. Kepner calls a thoracic surgeon to come see Avery the next morning. The next morning, December 7th, 2015, the thoracic surgeon comes in to tell Avery what she thinks the best case scenario is. Because Avery is so young and it is somewhat uncommon to have emphysema at such a young age, Dr. Christina Yang decides that a resection of the bullae would be the best case scenario. Being put on the transplant list would take too long, and it is not worth the risk at this age when there are other options available. Avery goes into surgery later that day, where the thoracic surgeon performs a surgical procedure inside of Avery's chest. After a long surgery, Avery is sent to ICU, then recovers for another week before returning home. 8 weeks later, in January of 2016, Avery goes for a follow-up appointment with her pulmonologist. Avery's surgery was successful with no complications. After the 8-week recovery period, she is now allowed to begin returning to normal activity instead of being bedridden for the majority of her days. She still must take careful precautions to prevent her emphysema from advancing, and she still must take her medications and attend respiratory therapy. Although Avery is unhappy that she has to quit her job as a cosmetologist due to the fumes and chemicals used, she's elated to finally be back on the mend. Her pulmonologist mentioned the possibility of a lung transplant later down the road if her emphysema seriously escalates, but for now, Avery Crow is on the mend.